NeedyMeds users and friends. Thank you so much for joining me today. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds. And today I'm going to teach you how to find healthcare cost savings resources on the NeedyMeds website. Before we get started, I want to go over just a few things. You can feel free to ask questions at any time by typing them into the questions section of your GoToWebinar control panel. But no, I will reserve answering questions until the end. If I don't get a chance to answer your question during the webinar, I will follow up with you personally via email after the webinar by tomorrow morning. Of course, I will provide my contact information and the contact information for NeedyMeds at the end, should you have any questions in the future. Also, this webinar is being recorded and will be available for viewing on the NeedyMeds YouTube channel, which I will direct you to during our presentation. And a copy of my PowerPoint presentation can be found in the handout section of your control panel. So for those of you that are not familiar with NeedyMeds, we are a national nonprofit founded in 1996 by a retired family physician, Dr. Richard Sagal, who is still our current president. What you're looking at on our screen is all of the fancy wording, including our updated mission statement and how we achieve that mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, which is needymeds.org, and through our helpline, which is 1-800-503-6897. But most importantly, how do you find cost savings programs on the NeedyMeds website? So bear with me while I transition out of the PowerPoint and onto our live website so I can walk you through exactly how to do that. So as you can see, just from a quick glance at our website, we have tons of information. And since we are going to spend almost all of today's webinar checking out cost savings resources under the Patient Savings tab, I encourage you to explore our site further when time allows. For now, I just want to point out a couple of other things that I wanted to bring to your attention. First of all, on the top right-hand side of the website, you'll see a bunch of social media icons. The third one from our left is the icon to our YouTube channel that I mentioned at the beginning of this presentation. We encourage you to subscribe to that channel to stay up to date on all of our latest videos and webinars. So again, that's another resource that you might want to check out when you have a little bit more time. Also, on the left-hand side of our page, our home page, you'll notice a box dedicated to Be MedWise. This is a website that is now hosted by NeedyMeds, which has tons of information on accurate and up-to-date patient information and education, and it's specifically a great source for medication safety. And also something I'm really excited about that actually you can see right on the announcement section of our homepage is that we just updated our monthly patient assistance newsletter, which is what it used to be called, and features health-related articles and valuable resources for advocates and patients. You can find that under the Advocates tab, and when you click on the NeedyMeds monthly newsletter, you'll see that it is now called Vitals, and you saw that also on the home page of our website. You can sign up to receive our updated monthly newsletter by clicking on that subscription center where my mouse is hovering at the moment, and you can also check out our most recent edition by visiting our archives section. So let me bring that up to give you a quick glance at what that new newsletter looks like. So please do check that out. So with that, let's get back into the purpose of this webinar is making sure that you feel comfortable finding healthcare cost savings resources on our website. As I had mentioned a moment ago, the Patient Savings tab is where you can find all of the patient assistance resources that will help you save on those healthcare expenses. And one of the most popular and effective ways you can do that, save on your medications, is with our very large database of prescription assistance programs, which, as you can see, is in the very top left box. For those of you that are not familiar with prescription assistance programs, they are programs that are usually supported by pharmaceutical companies and most of the time offer free and some of the time offer deeply discounted prescription drugs, usually name brand, to those that qualify. Of course, not every drug will have a prescription assistance program. When one is available, the eligibility requirements and applications will vary from program to program. One common requirement is that the patient's healthcare professional usually needs to be involved by providing the prescription, signing the application, and submitting documentation. And as you can see, under this patient savings tab, there's a bunch of ways you can search. You can search by the name of the drug, or if you're familiar with it, by the program that's supporting it, or even by the company that's supporting it. So let's say you're looking for help affording a name brand drug, such as Eliquis. You would go ahead and choose the brand name drug hyperlink. And when you click on that, what happens is a bunch of icons pop up. And what these icons do is they show you what type of information and cost savings programs are available. Does that drug have a prescription assistance program or a coupon? Does that drug have support pages, which provides more information about that medication? Or does it offer a drug video, which is exactly what it sounds like, a quick video providing pertinent information about that medication? You'll also notice that there is an A to Z index. Let me make that screen a little bit bigger. For our larger databases, we do have this A to Z index to make your search easy. Let's return to our search for Eliquis by choosing E in the A to Z index. And once I do that, I'll scroll down the long list of medications to see if that medication is listed. Once you find it, you will click on the hyperlink that has the name of the drug. And there are those icons again. The two icons on the far right indicate that there is more information available about that medication. The one on the far right indicates that there is a drug video. The one next to it, to the left, indicates that there are support pages. This one indicates that there is a coupon or rebate available, and the one on the far left indicates that there is at least one prescription assistance program available. I'm going to go ahead and click on that as it is a hyperlink as well. I'm going to take a moment also because I'm getting some feedback that we do have an audience member having difficulty with the sound. If anybody else is having difficulty with their sound, please send me a message in that questions section of your GoToWebinar control panel. In the meantime, I'll continue. And you'll notice right here, let me make that screen just a bit smaller. When I clicked on the prescription assistance program icon, this is what popped up. This means that there is a prescription assistance program available from Bristol Myers. If there was more than one prescription assistance program available for that medication, it would indicate it at the top in this blue box. It would say possibly program 1 of 3, program 1 of 2. And if there is more than one, then the program that offers the most assistance will be listed at the top, and the ones that offer the less assistance will be listed at the bottom. So let's talk about what we're looking at on our screen right now. And again, I'm going to make that a little bit bigger. Importantly, at the top, under the name of the supporting company or foundation, you'll find the contact information for the program. And that's really important because you're going to want to be sure to direct all questions about the program to the contact information provided, as opposed to asking any questions you may have to NeedyMeds. So I'm going to go ahead and make my audio a bit louder because I know our audience members are having some difficulty. Keep me posted if the sound issues persist. Anyway, getting back to what you're looking at on your screen, as I said, if you have any questions, you're going to direct them to the program, not to NeedyMeds. Next is the application section, which will provide a hyperlink to the application or information that you need to obtain that application. The medication section underneath that is where you will find all the medications and formulations which are covered by this program. And of course, each program lists eligibility requirements section. So let's talk about what's in that section. As I had mentioned in the beginning, eligibility will vary from program to program, but it is almost always based on three factors: insurance coverage, income, and residency. So let's take a moment to talk about those three different eligibility requirements. First of all, insurance status. Now, as you can see, as indicated there, to be eligible for this particular prescription assistance program, the patient must not have prescription coverage. Don't, however, make the mistake that I did before I worked at NeedyMeds. I made the wrong assumption that prescription assistance programs are only available for people that have no health insurance coverage and no prescription coverage at all. And that's not always the case. So don't make the assumption if you're looking for assistance and maybe you have insurance but not prescription coverage, or you're helping a client that does have some drug coverage, that a prescription assistance program won't help them. That's not always the case. It's worth checking out. Now let's talk about the income requirements, which is, again, something that is always considered as when somebody is applying. Now, often the income requirements are based on a certain multiple of the federal poverty level. And so you can find that out where you, your client, or your loved one fits in those federal poverty level guidelines. We put in a convenient FPL income calculator right here. Let me show you how easy it is to use. Let's say you're helping an individual that earns $47,500 a year. You'll notice I only typed in the numbers. Don't type in commas, periods, or dollar signs. Let's say this individual is supporting a family of 3. One quick thing I also want to mention about the number I just typed in. That's the same income that you would put on your taxes, for example. So you type in the individual's yearly income, the size of the family that they're supporting, and that's all the information you need. You hit calculate, and the results indicate that this individual's yearly income is 222% of the federal poverty guidelines. Now, when I return to the website, you'll see that this individual does qualify because they fall below the eligibility requirements of 300%. Which is great. But what happens if the calculation showed that this individual was not eligible? Maybe he or she found themselves just above the eligibility requirements at maybe 305 or 310%. Well, when that happens, don't despair. If you find your income is slightly over the income, you can call the program and ask them to make an economic hardship exception. And if you still don't have any luck, you can always appeal. So we touched base on insurance status, on income requirements, and let's talk about residency. Residency is always part of the eligibility requirements, but again, don't make some assumptions, for example, that if you are working with a population that is undocumented, that they will automatically not be eligible. Be sure to check out the residency requirements where we will provide the detailed information for each program. Also, be sure to be mindful about the application process timeline, because you don't want to put yourself in a position of missing your medications. And we always encourage people to check out the additional information section. Now, there's no text here for this particular prescription assistance program, which is great, but this is where we would put other important information that may not fall neatly into the other categories. So I think that's important to make sure you scroll all the way at the bottom. So we have somebody asking once again where you find the income calculator, and I'll show you. If you scroll up right on the income eligibility requirements section to the right of that, you'll see a hyperlink for the federal poverty level guideline calculator. Hopefully you'll find that helpful. And a reminder that if you do have questions, you can submit them, as I see some people taking advantage of this, type them into the question section of that GoToWebinar control panel, and I'll do my best to answer questions that I don't get to during the webinar at the end. One other thing that's really important to point out is, let's say you're helping somebody that does not have access to a computer, doesn't have the internet at home. You can always reach out to our expert call center counselors. That number is 1-800-503-6897. And we do have Spanish-speaking counselors. A reminder that NeedyMeds headquarters is based in Massachusetts, so we are on Eastern Time. Now, before we move on to other cost savings resources on the NeedyMeds website, I want to point out this hyperlink section for help with prescription assistance applications. These applications can be complicated for people that aren't familiar with them. So we put together a directory that lists nonprofits that help people apply to these programs. And the places we have listed are usually free or will assist you for a very small fee. And as you can see, you can search in your area by zip code or more broadly by state. So let's move on to talk about other cost savings programs under that patient savings tab. Switching gears a bit, I want to point out our $4 generic discount drug program. This is where you can find low-cost generic medications available at major retailers. Now, although it's called the $4 generic discount drug program, most do range in price from $4 to up to $15 for 30, 60, or 90-day supply. And you can search for the generic medication you need assistance with a number of ways. You can search by your drug name, by a pharmacy or store in your area, but you can also do a broad state search, which I'm going to do just for the purposes of this webinar. So bear with me while my computer cooperates. So again, throughout this webinar, what I'm going to do mostly are state searches, just to keep it consistent, but you can search a lot more specifically for the programs you need in your area, for example, by using a zip code. So let's see what programs are available in Arizona. Now, you'll notice when the page pops up that you'll see right at the top how many programs are available for that state. So there are currently 5 stores or pharmacies in Arizona participating in the $4 generic discount drug program. And hopefully you'll agree that all the information you'll need is right on your screen, including the name of the store or pharmacy and a hyperlink, the name of the program, and really importantly on the far right-hand side, what that program offers. Oftentimes it will fall between the $4 to $15 price range, but sometimes it's a bit higher, as you can see, and sometimes they will estimate the savings with a percentage as opposed to a dollar amount. Let's move on to another helpful section of the NeedyMeds website, of course also under that patient savings tab, and that's to our free, low-cost, and sliding scales clinics database. We're pleased to let you know that we have more than, I think it's just over 16,000 clinics in this database. And as you can see at the bottom, the databases are broken up into medical clinics, dental clinics, as well as mental health or substance addiction clinics. They're all set up the same way, but for the purposes of this webinar, I'm going to go ahead and just show you what the medical clinics database looks like. So yeah, we have more than 16,500 clinics in this database. And one thing I want to say about the medical clinics, even if you or a family member or client does have a primary care physician or a doctor they see, being aware of a clinic in your area is a good idea. First of all, if you don't have a primary care physician and you're looking for one that is affordable and convenient, certainly check out this clinics list. But as I had said, even if you already do have a doctor, this is this is great information to have on hand because you may find yourself or a loved one or a client in need of medical treatment outside of your doctor's office hours. So this can be an alternative to an emergency room. Now, certainly not if it's actually an emergency, but sometimes people wind up in an emergency room not because it is necessarily a medical emergency, but maybe they feel they have no other option. Now, this database is pretty large. You can search a number of ways. You can search specifically by your street address or by your state. But since it's such a large database, I'm going to do a more narrow zip code search, just so you can see what the results will yield and what this looks like. So let's do within 5 miles of that 94974 zip code. Now, like the other databases, hopefully you'll agree that all the information you need is now on your screen. And the results yielded, as you can see at the top, that there are currently 8 free, low-cost, or sliding scale clinics in the 94974 zip code. So what you'll find here is the clinic name, of course, contact information, and a hyperlink to the website if they have one. You'll be able to see who's eligible to be treated at that clinic, and whether or not you should, for example, expect a fee, and also if there are other languages that are spoken by the staff that works there. The details column on the far right will provide exactly that, additional details you might be interested in, such as the services they include and the hours of operation. Now, although we pride ourselves on the information on our website being accurate and up to date, we always stress giving the clinic a call or visiting their website to confirm the details that would be important to you, a loved one, or a client. Now, a really helpful tool is this print column on the left. Let's say you wanted to share this list of clinics. You can choose the print all option. It'll do just that. It'll generate and print a list of all 8 of these clinics. If you want to narrow it down a bit more, you can click on the clinics that you're interested in on the left-hand side and choose the print instead of the print all option. And this will do just that. It'll print a list only the ones you chose. And again, that's a great tool. Certainly if you're a healthcare professional that may want to provide your clients with a list of clinics for them to choose from. Now, returning to that patient savings tab, another destination on our website I want to point out is our coupons section, and that's on the bottom left-hand side. Now, although this is called coupons, rebates, and more, the reason we added the and more is because it really covers anything such as a savings card, a free trial, a free sample, a coupon. And this is a directory of all prescriptions and over-the-counter medications or supplies for which there is a discount. Just like our other databases, you can search a bunch of ways. You can search by the name of the drug. You can search by the product name, but in this case, you can also search by the category, which means medical category. So let me show you what that looks like. Let's say you needed help affording medications or supplies for somebody living with asthma. You could go ahead and click on that. And there are those icons again, just like in that prescription assistance program database. Those icons will let you know what additional support is available for that medication or supply. And then they're listed in alphabetical order, as you can see. We did update our coupon section of our website. We used to just have a text description, but it was a little bit, I think, more difficult to read, so we broke it down into bullet points. We also provide the manufacturer's website. And we also put a convenient way to text, email, or print out the NeedyMeds drug discount card, which is another great way to save on medications. And of course, we'll cover that a little bit later in today's presentation. Now, hopefully, you're starting to see that the NeedyMeds databases on the website are set up similarly. And of course, that's purposeful. We want to make sure the website is as easily negotiable as possible so you can find what you need within a few clicks of the mouse. Now, aside from prescription assistance programs, the second greatest source of savings is through our diagnosis based assistance programs. And if you can see where my mouse is hovering, that's in the center section under that patient savings tab. Diagnosis based assistance programs provide financial assistance for costs associated with a particular diagnosis. Now, this database is different because, for the most part, it does not include medicine. What it does include instead are other necessary medical expenses. Maybe somebody needs help affording medical supplies or durable medical equipment or testing supplies, or maybe they need help affording things like a wig or house cleaning services or assistive technology. You can search for a number of for diagnosis-based assistance program a number of ways. You can search by the program name, which is probably the least common way to search. You can search geographically to see what's available in your state or nationwide. Nationwide meaning that regardless of where you live in our country, you'll be eligible to apply. And like the coupons database, you can also search by diagnosis. Now, I like to use the example of diabetes. And as you can see, because this is such a large database, we do have the A to Z index. So I'm going to go ahead and choose D for diabetes. And the reason I choose that is because not only is it such a common diagnosis in our country, but it's a great example of a diagnosis that requires a lot of expense sometimes in addition to just medication. Now, since that's a large category, we have it broken down into a number of subcategories. But for the purpose of today's demonstration, I'm just going to click on the general hyperlink for diabetes. And as soon as the results come up, I want to show you how easy it is to see now what's available for those living with diabetes. And there are currently 63 diagnosis-based assistance programs available for those living with this diagnosis. And then they're listed alphabetically. And as you'll also see, with the national programs at the top. And again, that means regardless of where you live in our country, you'll be eligible to apply. And again, hopefully you'll agree that all of the pertinent information is now on your screen. The program name and a hyperlink, the summary, and most importantly, the far two right corners. Services provided column lets you know exactly that. What is this program going to help provide this patient? And often they do provide help with medical supplies or assistive technology, but you'll also see that they provide help affording a broad range of healthcare needs, such as maybe somebody needs some respite care, or maybe they're looking for help getting a service animal. And then after the national programs are listed, as you can see on the far right-hand column, then the programs will be listed alphabetically by state. Now, because we're talking about diabetes and the possibility of getting help affording medical supplies, which may include things such as needles or syringes, make sure you know how to responsibly dispose of needles and syringes by visiting the NeedyMeds Safe Needle Disposal website. I want to point that out really quickly. We're not going to spend any time there. I just want to make sure that you're aware that we do have that resource. Let me make the screen a bit smaller. And as I scroll down on the left-hand side, we have tons of information, as I said, but you'll see that box specifically for safe needle disposal. And again, that'll take you to the Safe Needle Disposal website, which was totally revamped in 2018. So check it out, and please do let us know what you think. So since we are on the topic of finding diagnosis-based assistance program, I also want to point out under the Patient Savings tab are diagnosis information pages. And these are exactly what they sound like. These are educational or informational pages dedicated to specific diagnoses. And our goal is to partner with reputable organizations, either nonprofits or governmentally funded organizations, to provide the most comprehensive information about a particular diagnosis. And as you can see, these diagnoses are listed alphabetically. I don't want to spend too much time here. I just want to make sure you know about this destination, especially if you, a loved one, or a patient is newly diagnosed. So let's talk about some of the other cost savings programs under that patient savings tab. I'm going to make the screen a bit smaller. And when I let my mouse hover over that patient savings tab, you'll see a whole bunch of other categories we didn't do a deep dive into during this presentation, but I do want to point them out. Last year, we did update our website by including a whole section specifically for medical transportation. A lot of people do need help getting back and forth to a doctor or specialized facility. And if you need that assistance, now we have a destination on our website dedicated to specifically that. We do also have databases dedicated to retreats, camps, recreational programs, and scholarships for those living with a specific diagnosis. And for those of you that are in or work with people, are in the category that are seniors or work with the senior population, I suggest checking out the government programs section of our website. Of course, you can find all state-sponsored programs in general, but this page has pretty exhaustive information on Medicare and Medicaid. So I think that's worth checking out. Now, if you bear with me, I'm going to go ahead and escape out of the PowerPoint presentation, back to our PowerPoint presentation, so I can out of our website to our PowerPoint presentation, so I can talk to you about another important way to save on your medication or other healthcare needs, which is with the NeedyMeds drug discount card. So what you're looking at there is a recap of the cost savings resources that we covered just a moment ago. And now we're going to move on to talk about the NeedyMeds drug discount card. So I'm sure you're aware that there are other drug discount cards available out there. Let's talk about why NeedyMeds is different. First of all, ours is free. You can obtain it completely anonymously. There is no registration, no enrollment, no residency requirements, and no activation. The NeedyMeds drug discount card can be used for prescription medications, over-the-counter medications as long as they're written as prescriptions, and even on your pet medications if you pick up at a People Pharmacy. Send me a message in the question section of your GoToWebinar control panel if you're interested in learning more about how to use our drug discount card to save on your pet meds, and I would be happy to send you a link to a less than 10-minute video we put together walking you through that. And really importantly, you'll get to see a picture of my puppy, Benjamin. So a few other facts about the NeedyMeds drug discount card is that not every drug or supply will be discounted, and our card only works at brick and mortar pharmacies. It's not accepted online. Our statistics do show us that the card provides a discount 85% of the time it is presented to the pharmacist. So an important question, who can use the card? The simple answer is anyone. The only rule is it cannot be combined with insurance. So if you don't have drug coverage or insurance, you can use the card anytime. If you do have insurance, you may choose to use the card instead. And you may do that because maybe you find that particular medication is not covered under your insurance. Maybe you find yourself in a coverage gap. Maybe you have a high copayment, or maybe you have a high deductible. So it's a good safety net. So let's return to the NeedyMeds website so I can show you not only where you can request your NeedyMeds drug discount card, but also the tools to maximize savings. So as you would imagine, there's a number of ways on our website, a number of links that will bring you to the page where you can request your own NeedyMeds drug discount card. Just like I had mentioned earlier, if you do need some assistance navigating the website or you want to refer somebody to NeedyMeds, you can always call our expert call center counselors at 1-800-503-6897. That number is on the top right-hand side. And you can also call them to request drug discount cards. Under the Patient Savings tab, there are a couple of links to the NeedyMeds drug discount card on the top left-hand side and the bottom right-hand side. But right from our home page on the left-hand side, you'll see a box with a red arrow that says, Get your NeedyMeds drug discount card. and you can request one right from here. You can print one out by clicking on this downloadable PDF. You can complete this form and then choose a design. Sorry about that, folks. Our internet seems a little unreliable today. Scrolling up, you can choose a design out of one of those 4 designs after filling out that form above. And you can also, I think this is the least easiest way, but it is an option, you can send us a self-addressed stamped envelope to our P.O. box. So now let's say you have your drug discount card. The next step is finding out what pharmacy in your area accepts the NeedyMeds drug discount card. And the chances are there's going to be at least one, if not quite a number of them, because the NeedyMeds drug discount card is accepted in more than 65,000 pharmacies nationwide. So I'm going to type in a zip code in the pharmacy finder. Let's just do 5 miles within 80906 zip code. And let me show you what the results look like. The results will let you know the pharmacies that participate in accepting the NeedyMeds drug discount card, and you can see there are 27 pharmacies within 5 miles of that 80906 zip code. And it provides the name of the pharmacy and their contact information as well. You'll see to the left they each have a hyperlink with the word map, so you can click on it and see where exactly it's located. And of course, you can choose the print all option to do just that, print all 27 pharmacies, or you can choose only the ones you're interested in and then choose the print selected. And it'll do just that. It'll generate and print a list of only the pharmacies you are interested in. So now let's say you have your drug discount card, you know what pharmacies participate. Your final step is finding out what your medication will cost you at that pharmacy when you use the NeedyMeds drug discount card. And you can find that out by clicking on the drug pricing calculator on the left-hand side. And to find out how much the medication will cost you using the NeedyMeds drug discount card, you'll need 4 pieces of information. You'll need the name of the medication, the day supply, of course the dosage, and the zip code where you plan on picking up that prescription. One quick thing I do want to mention about the drug pricing tool is that it provides an estimate. Now, although it's a close estimate, it will not be accurate down to the penny. And also do keep in mind that drug prices change all the time. So don't find out what the drug costs today and go pick it up a month from now. You're going to want to check out what the price is right around the time you're planning on going and picking it up. And again, just to reiterate, if you don't have the access to a computer or the internet, you're having difficulty doing this on your own, of course, our expert call center counselors would be happy to do that work for you. I also want to point out on the left-hand side, you'll see a hyperlink to NeedyMeds Storylines. That is a free self-care app that makes it easy for you to track and manage your own health conditions as well as the health conditions of a family member or loved one or friend. And it also allows you to access the NeedyMeds drug discount card and other information resources on assistance programs right at your fingertips. So again, check that out and hopefully download it and tell us what you think about it. So bear with me as I escape once again out of our website and back to our PowerPoint presentation. And encourage you all, I do see some questions coming in, so I'll encourage you all to please go ahead and submit any questions to me you may have by typing that into the questions section of your GoToWebinar control panel. And again, if I don't get a chance to answer your particular question, I'd be happy to follow up with you via email. So I do encourage you to sign up for our other upcoming webinars, and you can do that right on the bottom of the NeedyMeds homepage on our calendar of events. Upcoming later in this month, these 3 webinars I hope you join us for. RX Outreach, the webinar you see at the top, is a great partner and a resource you really want to familiarize yourself with, as it is a nonprofit pharmacy. No, that's not an oxymoron. It's an actual nonprofit pharmacy. Another partnership we are super proud of is our partnership with the American Liver Foundation. That second webinar you're looking at on that list is our first webinar in our 2019 series with our partners, American Liver Foundation. This one is specifically about liver wellness, something I've learned through our partnership that we really all need to know more about and do more about. And since I mentioned it during today's webinar, I wanted to bring to your attention the upcoming webinar about our Safe Needle Disposal website. So please do join us. As promised, as I answer questions, I want to make sure I leave our contact information up on the screen. And there we go. I put my colleague Alana's contact information up there because if you're interested in receiving a large supply of drug discount cards or NeedyMeds educational brochures, please shoot her an email. My email address is simply Carla with a C at needymeds.org. And of course, you can reach out to our expert call center counselors at 1-800-503-6897. So with that, I'm going to leave that contact information up, and I'm going to go ahead and attempt to answer as many questions as I can. Thanks, everybody. So one question coming in that we get a lot is, how is NeedyMeds financed? Thank you for that question. And you can actually find more details about that. Let me escape out of here back to our live website. Under our About Us tab, you'll find a link to our mission statement that, again, we just updated last year, and that will let you know exactly how NeedyMeds is funded. No surprise, like a lot of nonprofits, we, of course, do rely on corporate and individual donations as well as grants, but we also get our money from a few other sources. We provide license fees for organizations' uses of our database. We did create our own software called PAP Tracker, which helps clinics simplify prescription assistance programs, application processes. We do get a small transaction fee for every use of the NeedyMeds drug discount card, and we do have some thoroughly reviewed supporting partners on our website. If there is a pharmaceutical company or other organization interested in offering a prescription assistance program and they don't have a call center or processing center, we're happy to be that destination for them. But there's some more information on there, and if that doesn't provide all the information you're interested in, please let me know, and I'll be happy to provide more details about that. So let's go back to our PowerPoint and move on to other questions coming in, so bear with me. Let's see. Bear with me, I'm just checking out some of these questions. So here's a great question. If we don't have a printer, are we able to copy and paste information and send it to a patient? You should be able to. You should be able to, in the body of an email, send a hyperlink, or you can even do a screenshot. Feel free to email me if you're having difficulty figuring out how to do that, and I'd be happy to let you know. Bear with me one moment, everybody. Somehow I started our webinar over, so let me go to the last slide. Let's see. And yes, you can send any information that somebody else would be interested in via email. And again, if you have difficulty doing that, we'd be happy to help you with that, or you can give our expert call center counselors a call. I did get some feedback that some people had difficulty with the audio. I apologize for that. Just a heads up, as I had mentioned, this webinar is being recorded. Hopefully the recording is unblemished. We will work to convert today's presentation into a video and post it on our YouTube channel. So we encourage you to check it out, view it again, share it with as many people as you think would be interested in. But we do offer our overview webinars every month. So hopefully you'll be able to join us for another overview webinar. And one quick thing about that. If you've taken the time to learn about NeedyMeds by listening to today's presentation, we encourage you to sign up every few months or so, because we do our best to keep our website updated as well as offer new resources. So just to stay in the know with what's going on with NeedyMeds, we encourage you to register for overview webinars a few times a year. So I'm getting a lot of requests for our to learn more about how to save on your pet medication. So for those of you interested in that, of course, I will send you an email again with a link to a video about that. Also, one of our audience members, thank you for noticing this, notice that on our drug discount card, it does ask for a $5 donation when requesting a NeedyMeds drug discount card. And I want to stress that donation is absolutely not mandatory. You can receive one or an unlimited supply of NeedyMeds drug discount cards free of charge. Thank you for asking that. So this slide deck for today's presentation is available right now in the handouts section of your GoToWebinar control panel. If you have difficulty accessing it, please shoot me an email. Again, I'm at carla@needymeds.org, or shoot me a message in that question section of your GoToWebinar control panel. I'll be happy to email it to you. So we have a question about what are the financial eligibility requirements for NeedyMeds, and that's a great question. It gives me an opportunity to drive home a couple of important points. NeedyMeds is an informational resource. We provide information on healthcare cost savings resources and educational information completely free and completely anonymously. And what I mean by that is you do not need to sign up for NeedyMeds. You do not need to enroll in NeedyMeds. NeedyMeds as an organization does not have any eligibility requirements. We are simply an informational resource, and you can check out the information we have through our website, needymeds.org, or by calling that toll-free helpline at 1-800-503-6897. We will provide you with the information that hopefully will help you to save on your healthcare expenses, and we do that for free and anonymously. And what I mean by anonymously is you don't have to register to our website. You don't have to provide any identifying biographical information about yourself for us to provide you with program information. What I believe the question refers to is what are the financial eligibility requirements for prescription assistance programs. Now, prescription assistance programs that are often supported by pharmaceutical companies are not governed by any laws or regulations. So the eligibility requirements will vary from program to program, and you will see each of the eligibility requirements listed on the specific prescription assistance programs on the NeedyMeds website. Although they will vary from program to program, they're almost always based on three important criteria: the person's income, their insurance status, and their residency. Thanks for that question. So we have a question about respite care that's listed under one of the tabs and whether or not that's reliable from state to state. So what that's referring to is under the patient savings tab, there's an entire section for diagnosis-based assistance programs. And those programs, as I said, differ from the other databases. That database differs from the other databases because for the most part, it does not include help for medication. It includes help for affording other necessary medical expenses. And the example I often use is maybe somebody needs help affording assistive technology or medical supplies. But diagnosis-based assistance programs offer a broad range of assistance. Some of them will offer help, for example, getting a wig or getting help finding somebody to clean your house. And some of them offer help with respite care, which our audience member is inquiring about, or maybe help getting a service animal. The question is, are those reliable from state to state? And the answer is that the diagnosis-based assistance programs will vary greatly from what's available from state to state. As I said, when you do the Diagnosis Based Assistance Programs database, the first programs that the results will yield are national, which means regardless of where you live in our country, you are eligible to apply. So it looks like I've answered all of today's questions, but if any of you are like me and another question will pop into your head as soon as the webinar is over, don't hesitate to reach out to me. Again, it's carla@needymeds.org. Give our expert call center counselors a call. And of course, since we are a nonprofit, I feel obligated to remind you that if you would like to support our work, or you're just completely blown away by my presentation today, you can donate to NeedyMeds by clicking on that Donate Now button. And that's what it looks like. It just popped up in my PowerPoint slide. You can find that Donate Now button on the top right hand of the NeedyMeds page. So that's all the time we have today. Thank you so much for taking your time out of what I'm sure is a busy day to learn more about NeedyMeds, and we do hope you keep in touch. Thanks so much, and have a wonderful rest of the day.